That's the optic canal. The nerve coming from your eye goes straight through there. That's the optic canal. This is the superior orbital fissure because it's a big crack. See it? This is the inferior orbital fissure because it's in the orbit of the eye. That little hole right there, it's actually right here, is the infraorbital foramen. And then this one barely has a little notch right there. That's the supraorbital notch. That's the one that if you feel right here, you can feel it. The supraorbital notch. This is the mandible. Anything that rubs like this is a condyle. Now, in some of the literature, they just call it the mandibular head. It's the mandibular condyle. This is the mandibular notch. And this is the coronoid process. Remember we had a coronoid process on the ulna? Well, here I have the mandibular condyle, the mandibular notch, and the coronoid process of the mandible. This is actually called, your chin, is actually called the mental protuberance. But we sometimes will just call it the mentum. That becomes important when we learn the muscles, because that muscle that wrinkles up your chin is the mentalis. So this is the mentum. The muscle that wrinkles the chin is the mentalis. If that's the mentum, this is the mental foramen. And right here is your mandibular foramen. Where the teeth are going into the bone, that's the alveoli.
Wait, where was the mandibular foramen?
On the inside, right there.
Your hand's like. Oh, okay. Okay.
And this straight part is the mandibular ramus. Ramus means branch. What's this?
Sacrum.
This is the sacrum. What's this down here?
The coccyx.
Coccyx, male or female?
Male.
Why?
It's not as curved.
It's not curving in as much.
Okay.
This is probably we would consider probably be a young male because it hasn't started curving all the way in, but it's going to curve.
So it is male.